Hub maintenance for PICs and CVCs. Once again, gather appropriate supplies. A pre-filled syringe, injection cap, needleless connector for each lumen, antiseptic wipes containing alcohol. Explain to the patient what you are about to do. Perform hand hygiene on entry to the room and don clean gloves. Open the package and attach the saline syringe to the injection cap. Maintain sterility of the syringe tip. Prime the needleless connector with the saline. Before accessing the hub, connectors or injection ports, scrub with alcohol for 5 seconds with a vigorous twisting motion. Allow to dry for at least 5 seconds. When replacing the hub, scrub the injection cap and catheter hub with appropriate aseptic agents. Allow to dry completely. Clamp the catheter if necessary. And remove the cap. With a clean alcohol swab, clean the cap of the hub for at least 5 seconds and let dry for 5 seconds. Remove the protective cap from the distal end of the injection cap needleless connector and attach it to the catheter hub. Unclamp the extension and verify blood return. Flush the intended lumen with 10 cc of normal saline. Use pulsatile technique. Never reuse your saline syringe. Perform this on each hub. This is for medication administration or flush for a PIC or CVC line. Gather appropriate supplies, 2 pre-filled syringes with normal saline, antiseptic wipes containing alcohol, medication in the syringe and clean gloves. Educate your patient on the procedure, wash your hands and don your gloves. Before accessing the hub, scrub it with alcohol for at least 5 seconds and allow to dry for at least 5 seconds, even if the hub has previously had a Curos cap attached. Attach a pre-filled 10 cc saline syringe to the needleless connector, maintaining sterility, and verify blood return. Once you have established blood return, using pulsatile technique, flush with the 10 cc of normal saline. Remove the syringe, take a clean, new alcohol swab and clean the hub vigorously for 5 seconds and allow 5 seconds to dry. Using aseptic technique, administer medication by connecting the medication syringe. Push the medication per recommendation. Remove the syringe. Take a new alcohol swab. Clean vigorously around the hub for 5 more seconds and allow to dry for at least 5 seconds. Attach a pre-filled syringe with normal saline and flush 2 to 3 cc's of normal saline, and then use pulsatile technique to flush the rest of the saline. If the medication needs more than 3 cc's of flush, use a separate syringe to flush and a separate syringe to use pulsatile technique, all the while cleaning with alcohol in between each syringe removal.